question and analysis, but to what extent intervention?
Sure. So let's think about the moms and what Amanda talked about, and again, the heterogeneity of those populations, again, that we all have the opportunity to care for. When we think about with the opportunity to look broadly across hundreds of thousands of people and narrow that down to the folks that are at risk. So food insecurity might involve food delivery in partnerships with Mom's Meals, as an example. It might involve fruit and vegetable prescription programs that are going on right now in the district, as an example. Financial literacy and economic well-being might involve programs like at ProMedica Health in Ohio, where they have a financial opportunity center and they educate and support their patients. They've seen a 20% reduction in their PMPM just through implementation of a financial literacy source.
So do you see your differentiator as a way for payers and providers to figure out how to focus interventions on the smallest subset of people that can make the most impact?
I think that's part of it, but I would argue that that's only a singular use case. So first of all, the opportunity to bring payers and providers together in a graded way, and actually ideally combine our government organizations and communities together, like that's what we're doing, and that's what we think is important. We think it's incredibly important to dive with precision around that subset, but we also think that it's valuable to survey the entire population. And so as CareFirst might be looking at all of your members, and you think about how do we redesign benefit strategy, how do we contract with providers around all of our patients, how do we compare the performance of our providers who care for a population maybe with higher social risk and the ones that are doing well versus the ones that aren't? Like, how do we either drive more patients there or identify where there are gaps and where some of those providers could be doing better?
Can you speak to any current healthcare systems that are utilizing the tool?
Sure. So ProMedica Health is a great one I mentioned just a second ago. They're an $8 billion healthcare system based out of Toledo, Ohio. They built a food grocery store in the largest food desert in Toledo. Like, this is who they are. They are using this across the board. We actually take in 7 data feeds. Their claims data from Paramount, which is their health plan, their EHR data directly from Epic. They're screening data on over 500,000 people. Their programmatic data. They're using it as they look at their Medicare Advantage population, their Medicaid population, and even their foundation is using it as a way as they are granting money to the state of Ohio of how they think about allocation of funds, and where does that money go to the right place.
So I know many of us began the population health journey a couple of years ago, and may have already made big investments and are able to access both claims and clinical data. Have you given any thought to leveraging your platform to allow us to take into account your access to the social determinants of health?
That's actually what we did. So our platform is available, so we provide the analytic platform, our social state, back to our customers. It is a way to both visualize geospatially as well as reports around populations. We also can deliver direct data feeds around the community risk and social risk of the populations to the individual analytic teams at our system and plan partners, and we see that as real opportunity. Our chief strategy officer is apt to say there aren't enough data scientists in the world that are focused on this, so we want more, and so if we can deliver that cleansed data feed back, we think that's really valuable.
To follow up on that, do you see the growth here, or do you see the profit coming from the product or from the wraparound services that you provide to work with the partners to be able to find out areas of return and strategies to be able to address?
This is a platform and product play, and I come from the service world. My last company was purchased by the advisory board. We were a consulting firm as part of that. We understand services. Services are required to help drive impact and help solve the big problems on the ground, but the value, the growth, and the scale is around the product and the platform itself, and actually around the data that we can start to provide. What's interesting for us is health systems are clients, health plans are clients, life science companies are clients right now. Associations like the Maryland Hospital Association is a client. Foundations, as they think about, again, allocating the money. So we think that there's a great technical opportunity.
As a follow-up to that, how mature is the service portfolio?
What's that?
How mature is the service portfolio?
So we provide service right now to 100% of our customers. We limit that right now, again, around the strategic services to help them organize, build the ROI, the business case around what they do, survey in a structured way the tools and resources resources they have in hand and where there are gaps in that, where their patients or members have needs and the services they provide so that they can actually fill those.
Thank you, Trenor.